Hi guys, welcome back to my channel.
Hi everyone, so the topic for today is hernia surgery. You know the different types of hernia. They will be discussed in detail in a later video. Now, what is hernia? Hernia is an abnormal protrusion of an organ or tissue through the defect in or weakness in a wall that normally confines it. Let's take an example of umbilical and paraumbilical hernia. We have, for example, if we have, this is our abdominal wall, right? This is our umbilicus. This area will be your paraumbilical area. Now if the muscles here have a defect, that is due to surgery or any other cause, there is rectus abdominis, transverse abdominis and other muscles which are present here, they have a gap or they have a defect within them, then the intestine can protrude out, and just adjacent to the umbilicus we will have a bulge which will be the paraumbilical hernia. So that paraumbilical hernia is a type of hernia, right, which is coming through the abdominal wall. If the intestinal contents come through the umbilicus, it is called an umbilical hernia. So femoral triangle is present, it is present here. So if abdominal contents, which is mostly intestines, come through the femoral triangle, it is called as femoral hernia. So inguinal canal is a structure like this. If they exit through the superficial, then they are called as direct inguinal hernia. So Hasselbalch's triangle, there is a defect in that. They exit through the deep inguinal ring, they are called as indirect inguinal hernias. So it can be these or there can be other types of hernias, but this is just a quick overview of the types of hernias. Now another way to classify hernias is on the basis of complicated, uncomplicated hernias. Uncomplicated hernias do not have any strangulation or obstruction. Now what is obstruction? This is your bowel loop, then it gets entangled within itself, that is obstruction. But if its blood supply also gets compromised, it is called a strangulated hernia, which is complicated hernia, right? So these are the different types of hernias which will be discussed later. Now what are the types of surgeries? The topic of today, there is the different types of surgeries. One is herniotomy, herniorrhaphy and hernioplasty. Now herniotomy is that it is the simplest and the most easiest surgery, where the sac is ligated, neck of the sac. So now any sac which is there, the sac will have intestine in it, right? This is your intestine. So then what will happen, the contents will be reduced, like here the contents will be reduced and the intestine will be pushed back, and then there will be a ligature will be produced over here, and the sac will be removed because the sac doesn't need to be there. So that is herniotomy, when no mesh is used, when no repair is done, just ligation and excision is performed. Now the next surgery is herniorrhaphy. So herniotomy, that is ligation and excision, plus there is wall repair in this. So it is most commonly done in elderly which will have muscle weakness, right? So there is an anterior approach and the posterior approach. Anterior approach is also called as Bassini's repair. We have hernioplasty. So in herniotomy, only the sac was ligated and excised. In herniorrhaphy, we also did a wall repair. Now in hernioplasty, there is herniorrhaphy, that is herniorrhaphy, herniotomy and posterior wall repair with a mesh placement. Whenever we place a mesh, it is called as hernioplasty. So as an overview, we can say herniotomy is when the neck is ligated and excised, it is called herniotomy. Herniorrhaphy is when sac is ligated, okay, and excised, but posterior wall repair is also done, it is called as herniorrhaphy. Hernioplasty is when sac is excised, posterior wall repair is done, and a mesh is also placed so that we can support the weakened walls. That is called your hernioplasty. Now one thing is that herniotomy, since only there is no posterior wall, we have not strengthened the wall, we have not placed any mesh, so the most common reoccurrence rate is present in herniotomy. herniatomy. So most common reoccurrence rate is herniatomy. So that was it for today.
Hope you like my videos. Do like, share and subscribe for more such content.